Hello, everyone, and welcome to another episode of Two Moms and Some Labels. Two Moms and Some Labels is a podcast for parents and caregivers caring for a child with a disability to come together in a shared space to network and to just gain ideas, share ideas on how to persevere through challenging times. And my name is Brittany, and today we have this episode to highlight a very, very important resource in the community. I get hear questions all the time about this topic. So I am very excited to be able to share this resource with you all, especially, if you didn't know that this was out here. So you can share it along with your family and friends also. So with me today, I have Jennifer, and she is going to introduce herself and the company that she works for. Go ahead, Jennifer, take it away for us.
Brittany, thank you so much for having me here tonight. I'm so excited to share information about everything. My name is Jennifer Clark, and I work with the Jacksonville Neuro and Clinical Psychology Group. And I am the Director of Community Outreach. And I'm just so pleased to be here to share with the community another resource that's definitely needed that I'm not sure everybody is aware is available. So I'm glad to have the opportunity to share that with you all tonight.
Yes, because I hear parents always talking about, I don't know where to go. Who do you recommend? There's only like two people that I know of, or I have to travel out of Jacksonville to go find someone to get testing done. So before I even get into that, can you tell us exactly, about Jacksonville Neuro Clinical Psychology Group and what they do?
Absolutely. So we conduct neuropsychological evaluations on a variety of ages. We start as young as age 2. So if there's a concern in the family that, a kiddo might be having some concerns with autism and they're looking for further clarification and diagnosis, we can provide that evaluation for them. If there's additional behavioral concerns, learning disability or ADHD, we can provide those evaluations starting as young as age 4. And we continue on up the time frame there and the age line if there's any concerns psychologically, if somebody is looking to confirm a diagnosis, if there's any concerns with Alzheimer's or dementia, we can also provide those evaluations as well. So on the short note, I say we can provide evaluations anywhere from age 2 to 102.
Oh, wow. Cool.
Yeah.
So I know that a lot of parents, like I was saying, they are looking for places to go and get evaluations done. They don't know where they can turn to. And then also, you guys start at 2 years old. Most of the time, like when I talk to other parents and even myself, they're like, oh, we can't give you a diagnosis or we can't evaluate until they're 3 or 4, or, okay, well, we're just going to wait and see, how things go, or they will just send a referral over to early steps and let them intervene if they have, developmental concerns. But this resource is never, or it has never been, given to me and a lot of families that I know to say, okay, well, I have, Jacksonville Neuroclinical Psychology Group you can go to and get testing done, for your child starting at 2 years old. So, this is really amazing that this resource is out there, because a lot of parents, they, have that fear and they get anxiety, just, thinking like, what if they have this? What if, what's going to happen? I don't know, what are the exact signs to look for, or what kind of preventative steps we can take to, try to get our child back on the right track developmentally, or, there's just so many unknowns because they're just waiting and waiting until 3 years old, or until they like graduate from the early steps program to go and get tested with Duval County Public Schools to get their child into the pre-K program. So you guys do the evaluations, educational evaluations too, right?
We do. Yep. So if there's ever a concern about a learning disability, and on the other hand, if there's evaluations for giftedness too, we can evaluate for that. So Oh yeah, we
Cool.
kind of run the spectrum, but we've been resourcing with a lot of different providers in the area, and talking with a lot of families and learning that there's programs out there that can help.
Hmm.
What we've come to realize is, a lot of them were working with insurance companies, and they require this diagnosis. We're a very big proponent of education, early intervention, and the sooner that you can get these things diagnosed and treated, everyone's going to benefit from that. So we are strongly urging families to just get out there and to start, connecting and getting these resources. If it's something that you've been concerned about, come in and get the evaluation. And then if there is something that's diagnosed, then we can connect you with the resources within the community to start getting those interventions into place. We don't want to wait until someone is older, because it is harder. Certain behaviors start to develop. And then there's concerns about that. The earlier that we can intervene and start getting these steps and setting them into the right motion, the better off for the families and the kiddos and things like that.
And so the testing that is done, the evaluations that are done, are these able to be used to like get a child into school, or like if they do the gifted tests, are they able to go and take that to, whatever district they're in and say, we have these results, and so, our child needs to be in the program, or do they still have to get their school evaluation from the county? And then, and if they feel like, something wasn't done correctly, or they want just like something for their self, is that when they come to you guys, or how does the evaluation, work like
Yeah,
that for the
the
parents?
schools are a little bit tricky. As I understand, they do their own in-house evaluation, because a lot of their evaluations are based on observations that take place over a long period of time. The benefit of our evaluations is that you can take the evaluation to the school board to assist if you need the IEP or the 504 plan. You have a medical diagnosis, which the school board cannot provide for you. The other benefit to having this diagnosis and these evaluations is because if they are looking for additional resources, ABA therapies, or different types of schools that they're looking to go to, or even out of school programs after school, they do need for insurance to cover the services, they will also require that diagnosis.
Okay. And so then if the parent, they need to take the results and well, first of all, let me say this. How long are the evaluations good for?
That's a really excellent question. I don't know that I have an answer for that one. I can definitely look into that. I know for
Okay.
our older, if we're looking at a dementia spectrum, we look to see them every, couple of years. But for the younger folk, I am not 100% sure on that one.
Okay, yeah, because I'm pretty sure like the school, they require for, kids sometimes to get or insurance might require for children to get like reevaluated for insurance purposes. And then maybe the school district also too. But I'm not quite sure. I'm pretty sure that they do. And as far as like the insurance, do you guys take insurance? You see people without insurance?
We do. Yeah, we're in network with most major medical insurances, and we do accept Medicaid and Medicare. So we can see virtually everybody. If there's ever a concern about self-pay, we would accept that as well.
Okay. And then do the evaluations have to be done in person?
They do. A lot of the evaluation is based on observation.
Okay.
And so we really want to have that face-to-face contact. We want to see how the kiddos are responding to us and to different stimuli and things like that in different settings. So yeah, we do need to see them in person.
Cool. And then, so how long has Jacksonville Neuro Clinical Psychology Group been in business?
At this actual practice for about 2 years.
Okay.
Yep. So we're relatively new to the area, but excited to be branching out and helping.
So is this the only location, or like do you guys have other locations like in other cities or anything like that?
This is it.
Oh wow.
Yep.
Okay.
Yep. But we're growing. I mean, we're constantly looking and just trying to meet the demands. So when I started, I think there were 3 of us doing the testing, and now we're up to 8. So we're really trying to fill the demand and making sure that that everyone's up and trained and being able to get those appointments and get people in as soon as we can.
So after the evaluations are done, do you guys provide any other types of services within the clinic, or do you like have a list of places or people that you refer the families out to get, to treat whatever their diagnosis is, or,
We
the
do,
services they
yeah,
need?
and that's part of what I do too, going out into the community and finding out who's out there. We understand that this process is so completely overwhelming for families. Where to start, what's the next step, how do I do this? So our goal is to, we're kind of the first step. Come to us for the evaluation. If there is a diagnosis, we're gonna tell you. We're gonna tell you what's going on with and what the next step should be. And we're going to give you a list of resources within the community that we've, vetted and met, and talk with. And, we're knowing who has a wait list, who has availability, and we're working to bridge that gap to help make it less stressful. So they know, okay, I have the evaluation. I know I can go here next. I know this is who I should call and what I should do.
And so like what does the staff look like as far as like social workers or doctors? Like what does the staff look like?
Yeah,
Who
all
are
of our
doing the
staff.
evaluations?
Yeah, all of our staff at a minimum has a bachelor's degree in some type of a psychology, and we have a couple with a master's degree as well.
Okay. And so do you guys have a waiting list? Like do you have enough physicians or clinicians at your clinic? Like how many people are employed at the clinic?
So we have, oh gosh, I think it's 11 now. We have 8 that do the testing. And then we have a psychologist. We also have a licensed mental health clinician. And of course, Dr. Ritter, who's the neuropsychologist overseeing all of us.
Okay.
So, and then I think we're bringing on another therapist now. So,
Cool.
yeah.
Okay.
In
And
terms
so, oh, go ahead.
Oh, you had asked about the wait list. Yeah, we do. We try to get the kiddos in as soon as we can. Our goal is to get them in within 6 weeks.
Okay.
It does. We do ask that there's some flexibility on the end of the parents, which I know can be a little bit difficult when you're trying to schedule these types of evaluations. But in the event of a cancellation, we're calling the kiddos first to try to get them in.
So the maximum time right now is about 6 weeks.
That's the goal.
Waiting for an appointment. Okay.
That's the goal. So you might call and say, what's the next available appointment? And it may not be within the 6 weeks, but we're hoping within the time frame of a cancellation that we will be able to get them in much, much sooner.
Okay. And so what does the whole evaluation process look like? How do families, set up the evaluation? What do they have to go through? What do they need to have in place?
Yeah. So it all depends primarily on the insurance. I mean, anybody can call and schedule an appointment on our end. That's fine. A variety of different insurance companies. Some of them will require a referral from a primary care physician. So we don't require it, but in terms of reimbursement from the insurance companies, we know which insurance companies do require it. So we're letting the families know you're going to need to call your physician and have them send that over. But it's not required to have it at the time of the appointment that you're trying to schedule. So, you can call and schedule it, but by the time the appointment rolls around, we have to have had it in our hand. So
okay. So, they set up the evaluation and they're ready to get the evaluation done. They come in for the appointment. Are the parents allowed to be in the room with the physician, while the testing is being done?
Mm-hmm. So yeah, we do break up our appointment into a variety of different phases. The first phase, we do have the parents in there as we're trying to get information, and we're trying to do things simultaneous. We're trying to watch the kids' behaviors. We're trying to get some background information, and we may even have one of the clinicians kind of sitting next to the kids, playing with them, just again for further observation to see how their interactions are going, while we're getting that background information from mom and dad. In terms of the testing, we do try to do it one-on-one, depending on the reaction of the kiddos. If we're finding out that it's causing any kind of stress or uncomfort level, and they're just not going to respond well to the clinician, and then we'll ask the parents to come back in. But our goal is to try to start it one-on-one.
Okay. And that is for all the ages that you do the one-on-ones?
For the kids, yeah. For the adults, it's one-on-one.
Okay. And so are they able to like fill out the paperwork before they come, or is everything done in office?
Everything at this point is done in the office. There are a lot of questionnaires that we do ask for the families to fill out, just to help gives us some more background information. So they'll be doing that in one room while we're doing the evaluation with the kids in another room.
So do they need to bring any type of like medical history, medical records with them to the appointment?
Nope, all that we can get is just self-report. That's fine. We don't have to have the documentation. We would recommend, if there was a prior evaluation conducted, that they bring that with them, just so that we can have a basis of comparison to look at the two reports to see if there's been any progression and of anything or any new developments.
Okay. And then so if someone does not have insurance, are you guys still able to see them?
We are, but it would just be an out-of-pocket expense.
Okay. So, days are hard, times are hard with the economy and things like that. And, we have a lot of single parents also too that really need to get the testing done for their kids. So is there any type of like scholarship funds they can use, or like a sliding scale fee or anything like that to help offset the cost of the testing?
As of right now, we're not working with any of the scholarships that are out there. And then in terms of self-pay, I would probably just recommend contacting the office. I'm not sure about a sliding scale, but what I can tell you is that I've been the fees are less than some of the major competitors that are out there, from what I understand.
And so where is Jacksonville Neuro Clinical Psychology Group located?
We are at 4500 Salisbury Road in Jacksonville. And I guess that's on the south.
Yeah.
Yeah.
Okay. And then so if people need to schedule an appointment, do they need to call? Can they email? Do they go on the website? How does that work?
All of the above are perfect. So if they go onto the website, there'll be a form that they will fill out requesting an appointment, and then our staff will call them back and find out what times and what dates work best. They can call us and email us as well, and then all of those options are fine.
Okay. So do you know how long it typically takes to get I guess like the evaluations back for the parents?
Within 1 to 2 weeks is our average length of time, but sometimes it is shorter than that.
So are the evaluations able to go directly to whoever they need to go to, or do the parents need to like actually come in and pick them up and bring it to whatever appointments that they need to go to? Or if they need to be referred out, are you automatically sending their evaluations to wherever you're referring them to?
So we have a patient portal that every patient comes in, the family would create for the kiddo. And what would happen is, if they did in fact come to us referred from a provider, we automatically send the report back to the referring provider. And then because it is a patient portal, the families can access it. They can print it out. They can bring it to whomever else needs to have a copy of that.
Okay. And I'm just looking at your form here also. And so do you get a lot of like older patients, or you just have like a variety of some of every age group?
We we're getting a lot more kids now than we have. I would have to say that is probably dominating. We started off seeing adults only and focusing on the older population. But now with the need out there with the kiddos, we are seeing a lot more of them.
So are you guys going to well, you probably will be doing this. So are you going to like different doctors' offices and letting them know that you guys are here and
Mm-hmm.
available? Because I
Mm-hmm.
know I talk a lot about, going to the doctor's office and there's like no information available as far as resources in the community so
Mm-hmm.
that parents know, like if you need testing and things like that. Like the only thing that I've ever seen was maybe early steps, but it's mostly like about medicine or,
Right.
if your child has a, like, if they're angry or, like sibling problems and things like that. Like I only
Mm-hmm.
see stuff like that as far
Yeah.
as therapy, but I've never seen any other type of like pamphlets or
Mm-hmm.
cards for resources in the community. So is that a
Right.
goal? Is that something that you're doing, going out to the doctor's offices to be able to, put your information up
Mm-hmm.
for parents to
Mm-hmm.
get that information?
That was the first step actually that we had taken, was giving that information to the pediatricians and letting them know that we're here. Um, in terms of allowing them to promote our company and to give out our pamphlets, that's been a little bit more of a challenge. I mean, every time I take my own kids, I'm telling them, hey, if you need this, I'm giving out pamphlets. But for there unfortunately is a little bit of a resistance on that end,
Oh,
to
goodness.
display it. But at least, we are educating. I mean, we're calling, we've gone out, we're sending faxes, various types of communication with the pediatric offices to let them know that we're here. And we have gotten a lot of feedback in terms of client referrals. But in terms of resources to the families, I'm not sure that that's been handed over.
Wow, that's crazy. I
Yeah.
mean, why would you not want to provide your clients, your patients with
Mhm.
this information?
Right.
I don't understand that. If it's something that more like they're scared to touch on and talk about, or some doctors' offices may have like a preferred
Right. It could be that too.
person that they
Mhm.
use or something like that. But that's definitely really important, like I said, because
Mhm.
no one would know that the resource is there
Right.
if they're not being given the information.
Mhm.
Because especially when you're at the pediatric office, they're immediately going to just say, okay, early steps, and
Mhm.
that's it, you know?
Right.
So,
And a
what
lot of
about,
the larger providers do in-house. They do the same services
yeah,
in-house. So they may not want
okay.
to, but what
Mhm.
I'm finding is I've spoken to families that have been on a wait list for over a year,
Oh my
and
gosh.
they're stuck and they can't get any services because they're just waiting. And
Mhm.
this is why I'm here to say you don't have to wait that long. You don't have to
Right.
just wait and not get services and not get the help, because we're here to help.
Goodness.
That's just crazy. It's crazy to think that, and that's, to just sit and wait for that appointment.
Yeah. And I know, like, when my daughter came from the hospital and we, came out of the NICU, like, they gave us this big packet that had like a whole bunch of other little pamphlets inside of it. And I'm sure like early steps was in there and SSI and some other things in there. Is that something, I don't know if they still do that, and I wonder if they do, because that would be really good to, have you guys' information
Mhm.
inside of those, folders, if they still do that, being given out to the parents,
Mhm.
once they're discharged from the NICU.
Right. Well, that might be another avenue we could take. I didn't think about that.
Yeah.
But because that is something that we're trying to put together on our end, is okay, you've come in, you've been evaluated, you have a diagnosis, here are your next steps. We're trying to
Mhm.
do that on our end, so they have, a number, a contact, a name, and they know an idea what they should do next instead of just kind of being lost and wondering what to do.
Yeah. And okay, so when I'm reading on the flyer and it says like chronic illnesses, so what does the evaluation do for children that have chronic illnesses? Is it just to diagnose the chronic illness, or
We are looking to see to diagnose it and then to see where they might be and to try to
okay.
establish a baseline. And
Okay.
then we can continue to follow them, year after year to see if there's been any improvement or any decline.
Okay. Nice. All right. So, yeah, guys, I, want to be able to highlight a business, especially one that is it's so important to be able to have. And, like Jennifer has said, and I know as a parent that there's waiting lists in most places, or you have to go to only 2 doctors in Jacksonville. Well, you have another option. It's here, it's available. And again, they specialize in neuropsychological evaluations, psychological evaluations, educational evaluations. If you have concerns about your child possibly having ADHD, anxiety, depression, autism, brain injuries, chronic illnesses, giftedness, learning disabilities, psychological disorders, they are here to help with all of those different specialties. And they're from age 2 to 102, like Jennifer said. So, they can serve the whole entire community. And they take most insurances, as she said. I hope that I asked all the right questions, and that if you have any questions, you need assistance getting the services started, you can reach out to Jennifer, and I'll have her give her information or how you can contact the clinic, or you can reach out to me if you're unable to, get in touch with Jacksonville Neuropsychological. I can't even talk right now. If you can't get in touch with Jacksonville Neuroclinical Psychology Group, then I will definitely help you get in touch with them. And so, Jennifer, can you let us know the website and the address, the phone number that they can be able to get in contact with you guys to set up an appointment?
Absolutely. So our website, it's www.jax, which is spelled JAX, psychology.com. The phone number is 904 800 6116. And our physical address, it's 4500 Salisbury Road in Jacksonville, and we're in Suite 420. We also do have a Facebook page if you want to check that out. It's Jacksonville Neuro and Clinical Psychology Group. And you can check us out on Google, and we're on Instagram. So we're trying to be on most of the social media sites as well. But absolutely, if you have any questions, I'll even my personal email, if you have any questions for me personally or that you don't want to call about or for whatever reason, it's the letter J, Clark, CLARK, at jaxpsychology.com. And I'm happy to help answer any questions or guide you in any way that I can, or at least if not, put you in contact with somebody that can.
Excellent. So this is definitely a tongue twister. I was talking with Jennifer before we started. I'm like, this is a tongue twister. I cannot get it out. So I am going to say the Jax Neuro Psychology Group that you guys are able to reach out to. But yes, Jacksonville Neuroclinical Psychology Group. I thank you so much, Jennifer, for sharing this information with the community. And I will definitely make sure that I post all of the contact information as well on Two Moms and Some Labels on the Facebook group. It'll be available on Spotify and YouTube also. So it will be there in the comment section to the contact information, so that you guys can reach out. Make sure that you go and follow them on Facebook as well. And if you know anyone in the community that is looking for testing to be done or didn't even know that they could go and have evaluations done when their child is 2, this is the resource here. So I hope that Jennifer was able to provide a lot of information and knowledge for you all. And thank you again, everyone, for tuning in to Two Moms and Some Labels. Our goal is to help bring resources to the community of parents and caregivers taking care of a child with a disability. We want you all to win. We all want you to thrive. So thank you for tuning in, and we will see you on the next episode of Two Moms and Some Labels.